Okay, we're live.
Great. Hey, hi everyone. We're really excited to have you all here with us at the People's Health Assembly today. I'm Kokali from the People's Health Movement US Circle, and I've been helping to plan this event with our colleagues in Canada and throughout the US. And today we have a really exciting guest who's joining us to talk about the intersections between public health and police violence, and her work specifically organizing against that around the Bay Area in California. So I'll let her introduce herself a little bit more. So Dr. Boyd.
Thanks so much for having me. I'm so happy to talk to the People's Movement about what some clinicians and I are thinking is a new, emerging, maybe not new, but certainly emerging issue in public health around police violence. I'm a pediatrician and child health advocate in the Bay Area, and I've been working with colleagues to better understand how police violence could be considered a public health issue.
Great, thanks so much. So to start off, we'd like to ask how your health work and background as a physician has motivated your violence organizing work, and how you sort of got interested in it, and how you see your health background and health lens influencing that work.
For me, I think my interest in this topic started as more personal than professional, to be honest. I think as we've all seen the videos, the horrific videos of police violence across the country, I think it's touched us all in personal ways, but particularly as a Black woman who has Black family and Black friends, and who has experienced Black family and Black friends having intimidating encounters with police, there was something about what was going on that really made me afraid personally, that made me concerned and worried for my family personally. And so I think my interest in these issues was really just to say, what can I do to make sure as a citizen that I'm addressing the impact these issues have on the people that I love and care about. And then as a professional, when you watch these videos, the next thing it makes you think of is, or that makes me think of as a physician, is what does it mean to witness violence? And that's something that's well studied in medicine. We know that people who witness violence are at risk for other poor health outcomes for poor mental health, as well as poor physical health. And so when you can see these videos propagated across the internet, a new question that arises is what happens when we also watch these events virtually? Will it affect us the same way? And while there isn't a lot of data about the physiologic impact of watching these videos virtually, there certainly has been enough outrage and concern in the community that a lot of people are galvanized to do things about it, regardless of their profession. And in medicine, I think our role is to think more about what the physiology of what's happening for that individual who's a victim of what we're calling an adverse police encounter, or for all of us who become the bystanders, either in person or online.
Mm-hmm. Thanks. And so you mentioned data, or maybe better way to say it is a lack of data. But where do you get any kind of data there may be that informs your work? And in what role does that play in your campaigning?
So the data piece has been really important, because as these events happened and we all kind of watched them roll across news screens and across our cell phones, there was a sense that perhaps we're capturing something egregious, but not necessarily a pattern or not necessarily a trend. And so as a scientist, I guess, in some respects, as a physician, our community was wondering, how can we put this in context? You know, how many people are we talking about? Is this just an anomaly? Are the events that we're seeing outliers, rare events that just happen to be captured? Or they describe something that happens more regularly, something that we maybe have been missing as a major cause of injury, disability, or death in certain communities, particularly communities of color that we know are most affected. And so the first place we went to look at the data is to the kind of federal repository of data. So the federal government rather, has been collecting data around deaths that occur as a result of police encounters. There are some holes in that data because most of that reporting is done at the precinct level and it's voluntary. And so although the FBI and other federal agencies collect that data, there's kind of a disincentive perhaps for officers to really report when it's not required, and certainly when reporting may implicate that they did something wrong. So I think it's been well known that the data at the federal level isn't great. And so what's emerged instead is a number of crowdsourced databases. So organizations like Mapping Police Violence, which was started by activists out of Oakland, that looked online at social media accounts, newspaper reports, and compared them to other existing databases of like formal accounts of events to see what is the actual magnitude of these issues. The Washington Post has one, The Guardian's, a UK newspaper has one called The Counted. So a number of those kind of popped up in the gap where we didn't have much data. And on the health side, while we don't collect this data now, there's been a very interesting discussion about how we could do a better job potentially contributing to that data collection. Because if any of these encounters result in physical injuries or a death, then those people, or in the case of bodies, those bodies will come through the medical system, either to the coroner or perhaps to an urgent care or an emergency room. And so there's discussion about whether or not we could do more to actually identify which injuries or deaths are actually as a result of a police encounter in our medical records, and then through a reporting system where public health departments can then share that data with other public agencies, so that together, perhaps with policing data and with health data, we might have a better picture of who is affected and how big is this problem.
So has that been the focus of your work, or maybe you could just tell us a little bit about what it is that you've been doing in this area?
Yeah, definitely. So there's been two main focuses of some colleagues and I from the Bay Area. The first is that data piece. There, what we've started with is just discussing what are the options. The first option we considered was actually put forth by a social epidemiologist at Harvard School of Public Health, Nancy Krieger, who suggested that health departments consider making deaths as a result of a police encounter a reportable event. So there's a precedence in medicine that if certain conditions, usually it's communicable diseases, so infections that could spread quickly or particularly deadly, if doctors see that or diagnose that, then there is a time limit, usually 24 hours to a few days, where you have to report that diagnosis to a health department. And so Nancy Krieger's suggestion was that we use the same process to identify injuries and deaths related to police encounters. So we talked in the Bay Area with representatives from our 9 Bay Area County health departments about what that might look like. The truth is, as you start to have those conversations, what comes up is what level of quality, I guess, will you have when you produce that data? And then what will we do about it? So right now, because there isn't an organized kind of public health response to these issues, at least in California and in the Bay Area, there's concern that as we collect this data, maybe there's not an immediate actionable step to take. That certainly isn't a reason why we shouldn't collect the data, because we do need to build evidence for why we do need to build out these processes, but it became a little bit of the pushback as to why we don't immediately switch to start collecting this data. That was kind of the first idea. It's how pursuing a pilot requiring health departments to start collecting this data. Now we're saying, what if we just took one emergency room and asked those physicians there to report it to their local health department? How many incidences would there be? Is this something that's relatively common, or is it relatively rare? What are the paperwork burdens, and how can we make it a more transparent process? So right now we're exploring with some partners whether or not it makes sense to proceed with a more local level pilot before doing something at the health department level that's mandated for all physicians in any particular county. And then the other piece that we've been working on is allowing health departments and other clinicians to support community advocates who are in the community providing direct-to-community services. So there, we're hoping that the data that we collect can better direct where community advocates focus their resources. But we're also hoping that as community advocates, in particular in the Bay Area, we've been working with an organization called the Ella Baker Center for Human Rights. And what the Ella Baker has done that's been incredibly innovative is to train what they're calling justice teams, which are community-led teams made up of communities who are most affected by events of police violence. And when there is an event, these individuals are trained to be like first responders or a crisis response network. So they can go to the scene and provide basic first aid services, but that they can also follow up after an event if those first aid services aren't necessary with the family and the community, because we know that there's going to be other social service needs. And so our goal was to make sure that as they identify those needs, that they can be easily and quickly plugged into the larger social service network in their county, whether that be through legal services for the family of victims or mental health services for witnesses and bystanders, or social services for the community as they deal with the impact of witnessing such a traumatic event.
Cool. So I think you just gave a really great example that a lot of people here in the room will be interested in, about how community people can focus their efforts and really kind of have an impact on these issues. How do you have any thoughts on how best people can sort of tune in to this work in their communities, and how they can partner with health professionals and people who are already working on these issues? I know your experience might be very specific to the Bay Area, but we have people across Canada and across the US as well who are interested in doing some of this work in their communities. And if you had any advice for them, that would be great.
Definitely. I think there's different ways to get involved for different professionals and for people who take different roles in their community. So for some people that perhaps, can't go out and protest, that maybe don't have time during their day to really be involved on a day-to-day basis, donating and supporting organizations that are working on these issues, like the Ella Baker Center for Human Rights in Oakland, or the Movement for Black Lives, or Campaign Zero. On my blog, which is Rhea, RHEAMD.wordpress.com, I just put up a podcast with a link of resources with organizations that people can consider supporting. The podcast was done with colleagues at Cure Violence, and is also about the intersections between police violence and public health. But there's a list of organizations there that you can consider just donating to, or going to their website and showing up at their meetings or their events that they're having. There's ways that you can plug in on a single event basis, or become more involved as one of their advocates and activists. And then for our clinician colleagues, I think, who may not want to engage that way, I think bringing these issues up in your work setting, asking your institution, what are we doing to acknowledge these events? Whether or not it's a policy statement to say that we recognize how police violence and public health are related, or whether it's processes and procedures in place in emergency departments to make sure that if somebody presents to your emergency department or your outpatient clinic sites, and you think they've been affected by an event of police violence, to then make sure that they get plugged in to necessary social services like legal services, mental health services, etc. That can be a really effective way to make change kind of at the clinical level. And then for those who kind of have time and energy, to consider just bringing together advocates in your area. You know, if you're in a place that's particularly remote, or you don't think you can be connected directly to any of the organizations that are online, then start something. Bring your community members together, and suggest what you think is great. And then go to your local government, go to your board of supervisors, and ask them to respond to the issues that you guys raise that you think are important.
Great, thanks. So finally, what do you think are the particular strengths of approaching the problem of police violence from a health perspective? Or not just strengths, but challenges as well?
An important reason why we have to start thinking about police violence as a public health crisis is more people should be working on this than just those who work in the criminal justice sector. When somebody encounters a police officer and has a negative outcome as a result, and that outcome could be an injury that's visible, it could be death that's certainly obvious, but it could also be things that are a little less obvious. It could be anxiety, it could be a mental health impairment, it could be you were arrested and now you're away from working and now there's less resources for your family or your community. So when those things happen, you have to think of the consequences down the line, and those consequences aren't isolated to that individual. If it's witness trauma, then all the people who are bystanders are also affected. If it's incarceration, then the community who then has to function without the social and economic support of that individual and their family and their loved ones are also affected. And in medicine, we know how these issues then affect health. How parental incarceration, so if you have a parent or caregiver who is incarcerated, affects child's health. You have increased risk of anxiety, migraines, asthma, or how having barriers to access to social services like food stamps, educational loans, jobs, because of your prior incarceration status, affects your family's economic health, which ultimately affects your health. So all of these things are related to health, and if we pretend that they're not, we're doing our families that we serve a disservice. So that's why I think it's really important to think about this through a health lens. What's hard about that is we're not used to it, that we didn't used to kind of categorize police violence in the same way. And as we talk to health departments who are one public agency and police departments are another public agency, sometimes it can be difficult to talk across agencies, particularly in a critical manner, about serious issues. And so there definitely are barriers to talking to who most, I think, health providers think of as their allies. You know, health and public safety are kind of aligned public services. And so while it can be very difficult to have that conversation because we want to be very supportive of each other, when we think of the outcome that it's having on our communities, it's really important to do it, even though it's hard.
Great. That's great. Well, thank you so much, Dr. Boyd. I think everyone in the room is really going to appreciate hearing this conversation and hopefully start to think about what they can do in this area as well and start to act on that. So yeah, thank you again. And I guess if you have anything more to add, I should give you the chance to do that actually, but we've covered all of my questions.
No, that's great. I think the last thing I would say is to vote, that this upcoming election in November is incredibly important, but local elections that don't fall on presidential election dates might be even more important. When you're picking your local judges, your local DAs, when you're picking your board of supervisors, these are the issues we want to be weighing their candidacy on. So certainly in November, it's really important to get out the vote. But every time you have the opportunity to go and exercise your rights. I think it's really important to speak up for these issues. If that's the only thing you can do, I think it's incredibly important.
Yeah.
And thank you for having me. I'm so glad we could talk about this.
Yeah, all right. Thank you.
You're welcome. Bye-bye.
Bye.